Post-Streptococcal Glomerulonephritis, PSGN, is a complication of your GAS pharyngitis of skin infection that presents with hematuria. That's your Coca-Cola colored urine and your facial swelling. So let's look at a little practice question to kind of make sure we iron down this concept. Like and subscribe if this is helpful. It really helps with the channel. 9-year-old boy brought to the clinic, facial puffiness, dark colored urine. 2 weeks ago, he's been treated for impetigo and also your topical antibiotics, and we got elevated blood pressure. Your analysis has +3 in the blood, +2 in the protein, and also your red blood cell casts. So this is going to make us think of subepithelial immune complex deposition. That's going to be your correct answer. So it's going to be a case of this kid who had a little sickness and now he's over it. Post-Strep, that's why they call it the Post-Strep. And he's got his group A strep infection and recent skin infection. He's got the impetigo, so that's the GAS, facial swelling, Coca-Cola, that's the hematuria, the Coca-Cola urine, +3 in the blood, red blood cell cast means it's a glomerular origin, and hypertension would be your volume overload causing the kidney dysfunction, and also your decreased C3 and normal C4 is the pattern that you see in post-streptococcal glomerulonephritis. So the pathophys, basically we have this group A strep infection, and you might see like pharyngitis. I'll scroll down so we can kind of see this and look at our answer choices. That is where the body makes antibodies. And then these antibodies, what do? They form immune complexes, yay, with strep antigens. And the complexes, get stuck in where? Where do the glomeruli? And where do they get stuck? Exactly beneath the epithelium. So it's subepithelial. That's the reason why it's our answer choice. And what happens next in this awesome story? Well, then we activate the complement. The complements, we give it compliments. We're like, hey, I see that you're stuck in the epithelium. That's awesome. Just kidding. It's a C3. And that causes the inflammation and also the damage. And this leads to hematuria, proteinuria. That's going to be a plus red blood cells and also our protein and also your edema and your hypertension. And so all these things are going to be happening. Symptoms are going to be 1 to 3 weeks after the infection. So that's the basic kind of story of what's happening here. Red blood cell, you're going to see in the urine, serum C3 is going to be low. Why? Why is that low? Because you used it up in complement activation. You gave it too many complements on its nice subepithelial lodging. The ASO titer could be increased because of strep. Anti-DNase B would be often increased because of strep, like impetigo as well. Impetigo, tomato. Other answers are wrong, like anti-GBM. Anti-GBN is going to be your good pasture's disease. And so why is this wrong? Anti-glomerular membrane antibodies. That's a very appetizing answer. Good pasture, and that's going to involve your linear IgG on IF, and it's going to affect also your lungs. All right, so we got a different mechanism there on the, and then the mesangial IgA deposition. That's going to be your Berger's disease. And that happens right after the infection, right after it, not weeks after. And the complement levels are going to be normal complement levels. Your T podocytes, what's that going to be? Minimal change disease. Okay, so you see this one in children, causes massive proteinuria and not hematuria. So this is going to be a really nephrotic syndrome, minimal change disease seen in children, the podocyte injuries. And the ANCA, the oncovasculitis, that's going to be your GPA, your MPA. You would not see immune complex formation, and it's usually present with your rapidly progressive GN and your systemic symptoms. Okay, so a super simple recap. Kid gets strep, immune complexes, gets stuck in the kidney filters, causes the bloody Coca-Cola urine, puffy face, and the complement system activates, so C3 drops and then C4 stays normal. The deposits underneath the subepithelial cells, so it's subepithelial humps. Yeah, that's pretty much it. All we need to know for our post-streptococcal glomerulonephritis. We'll see you guys in the next video. Take care. Adios.